I'm going to reiterate that point about David being a hard act to follow. I unfortunately was not here this morning, but I've met with him at the UN and seen him in action. So I appreciate you all having a bit of grace with me following his remarks. As mentioned, my name is Kate Maloney. I work at KPMG in our International Development Group and also on our United Nations Global Account team. So I'm, at least for the last 2 years, immersed in all things SDGs and immersed in the subject of engaging the private sector to come up with solutions that are sustainable, inclusive, and resilient to the breadth of challenges that we're facing with the SDGs. I'm going to give the clicker a whirl. Great. All right, so I think we're here to discuss global health, but also in the broader context. And I think although we see the green square, number 3, being the global health SDG, we really have to think about, and I think David mentioned this as well, the interconnection points with every other SDG. There's no way to be able to address all of the targets that sit beneath that green icon unless we're also looking at addressing climate change and poverty and gender equality and inclusive cities. And I think most importantly, to think about global health in the context of its link to economic growth. And there are just 3 statistics that I want to share with you. I'm not a statistician, so again, a little bit of space here. But KPMG has a global chairman for health who recently shared with us that were you to extend the life of a population by simply 1 year, we could stimulate an economy by up to 4%. The flip side of that, according to the UN's Organization for Food and Agriculture, were we not to tackle hunger and undernutrition, we could sacrifice GDP of up to 2 to 3%. And lastly, according to the United Nations Development Program, 63, and many of you probably know this because you're living it every day, 63% of all deaths worldwide stem from non-communicable diseases. So this is cardiovascular disease, cancer, chronic respiratory, and diabetes. The cost of not addressing these 4 has been estimated at $7 trillion by the year 2025. So you start to frame the global health challenge in economic development terms, and it sparks the attention of government and business to come together and really invest in this issue positively, as opposed to looking at it as this detrimental cost were we not to tackle it. So this graphic of a house is really the framework that I want to just encourage everyone to keep in mind when you're thinking about ways that your respective businesses may go after global health goals. It could be that they're sitting in SDG 3, but it may be that as a business you may have more comparative advantage to go after one of the other SDGs, but have a spillover effect into global health and well-being. So what is KPMG doing in this space? We're a professional services firm. I'm often asked if I am a tax specialist or an accountant, and I'm neither. I have an economic development background. But KPMG is providing tax advice. We are doing audits, but we're also consultants that are immersed in business along the whole value chain. So when the SDGs are being developed, and as you all know now, it was one of the most extensive consultative processes that we've had historically. Business was at the table since day 1. We can't not engage. But how do you take all of that knowledge and put it into something that might be useful to people like you in the room? So what we came up with was an initiative with the UN Global Compact, and the copies of this report are awkwardly in my purse, which spilled out at the table before I came up here. So I will share with you those after, and also provide a link where you can access them. But I think the most important piece to this publication is that we stopped referring to the private sector as the private sector, because I think you would each agree from different industry groups, there are different drivers and geographic footprints and DNA to business if you're in industrial markets, or you're a global healthcare company, or you're Levi Strauss producing jeans. So we identified 7 of these industry groups and pulled together our specialists in KPMG and put them together with the UN Global Compact universe. And what sits within this matrix are ideas that I hope maybe are inspirational to those of you in the room. The report is meant to be a tool. It goes through each of the SDGs and gives ideas for how business, most of them who've been at the frontier of this for a little while, are making investments that are shared value in nature. So this is not just the philanthropic activities that many corporations have been doing for a decade or more, but really starting to look at where your core business could help address one of the other goals. So beneath this matrix are a series of ideas, and again, I'll share with you the link at the end, but covering each of these industry groups. And again, just to reiterate that message, there's space for a transportation company to consider what they do and how that impacts health and well-being, just as much as there's space for Pfizer to be there wrapping their 42nd Street. I don't know if anyone is from Pfizer today, but this came up yesterday in a meeting that if you walk by their office on 42nd Street, it is wrapped in the SDGs. So you talk about a corporate commitment to this agenda, it's pretty significant. And this is long after the SDGs were launched. Just something to consider from a healthcare perspective. I won't read these in all detail, but the point is that beneath each of the tiles that capture our attention are numerous targets and a whole slew of indicators, and we won't go into that today. But I raise this list to emphasize the numerous touch points or entry points that could be relevant to addressing global health. And that could be ending global maternal mortality. It could be going after substance abuse, like one of my colleagues on the panel's company. Road traffic accidents are a major challenge. They've made their way into this goal. And then more broad terms like we know, universal healthcare access. In our matrix, we tried to group them into 4 buckets, and those, again, you'll find in the report that is being launched this week at the UN Global Compact Leaders Summit. So a number of businesses, some of you may be participating in this. The Healthcare and Life Sciences report will come out. But perhaps you consider the end of the spectrum that is preventative healthcare. You can think of universal healthcare coverage. You can think about healthcare through the lens of resilience and exposure to climate change and other systems that could be very vulnerable if there isn't planning in advance to protect hospitals and communication streams and roads and networks that help bring people access. And then obviously the whole environmental piece, how healthcare systems are designed and the products that help individuals are produced. So there's plenty of options. This is just to highlight the point from the very beginning. You have an insurance company who's in our financial services matrix, who has committed themselves to the health agenda, Aviva. You have Levi and Strauss, who we all are quite familiar with, who's equally taking a stand on a health and well-being initiative. And then AB InBev, who's here today, also taking a stand on an important issue around substance abuse. So the point again is that we'll see, no matter, irrespective of what industry group you may officially fall within, all 17 goals could be relevant places to make strategic investments of a shared value nature. I think the point on this slide has been hammered home a little bit, probably too much this morning before I arrived, but The ecosystem of business and civil society and government is ripe for all of us to be working collaboratively. There is trillions of dollars on an annual basis that it will take to deliver the goals. You have business wising up to the profit potential of making smarter decisions around the health and well-being of your labor force and or your future consumer base in markets that you may want to enter globally. And you have some new entrants to the equation. You have foundations and philanthropic organizations really looking to engage, and some traditional financial sector capital market players who are looking at new models to fund and meet these multiple trillion-dollar challenge. Were we to get there together, this is a simple point to say that maybe some of you have worked in the infrastructure sector and you know what a real public-private partnership is. It is an intimidating spreadsheet of hundreds of rows of debt-to-equity ratios. I swam in that ocean for a little bit, and it's why I'm here in this ocean, because it's quite complex. But it's a very commercial, contractual arrangement. Where we're trying to head, I think, in this type of fora is towards the transformational end, coming together as partners and leveraging your networks, your access to data, your intellectual capital, and your finance, so that by the time you move from commercial through something that's maybe more philanthropic, you end up at a truly integrated partnership that is about shared risk and shared operational models and shared decision making. And finally, no good presentation without a few tips to keep in mind. Some of you, I'm sure, have engaged in partnerships already, some perhaps a bit new to it. My team happens to be involved in a pretty large-scale resilience partnership currently. We are an implementing partner along with a foundation and our own, two bilateral aid agencies. And what we're finding is the most critical piece to all of this, I don't think it will surprise you, is trust and the maintenance of that trust. And I find just in my daily work as a consultant to organizations like your own, everyone is really excited about partnerships, and they want everyone in the room and all their big brands, all the right Gates Foundation and the One campaign and all the right governments, and they want everyone to come together for the brand power and the convening power. But were there too many people at the table, you can imagine it can become unwieldy, and then you almost have paralysis. So the message that we continue to really drive home is to slow down on the front end, because that trust piece will get eroded so quickly when it's not clear who has decision-making authority, and are you really aligned? Have you taken the time up front to figure out who are the intended beneficiaries of what you're doing? What are you doing to begin with? Who's going to benefit from it? And how long a time is it going to take to get there? So we get so excited to pull everyone together and get off and running. We're 2 years in, and there's still possibly a lack of clarity about where we're headed. So the partnership piece is critical, and I think David mentioned this. We're no longer in a siloed, do-it-yourself environment. But a few key things to keep in mind beyond the trust is just that upfront due diligence, to really have a sense of the decision, the governance structure, who makes decisions and how, and to think worst case, and you hope this doesn't happen, but if it needs to, that there's a structure for unwinding the partnership. And those of us who work in development know very well, everyone is so well-intentioned. And to our discussion before the panel, so many pilot ideas are popping up all over the world, and no one wants to give up. But there may be an instance where you need to. So thinking through, like you would a massive investment or a private equity deal structure, what is that potential to remove yourself, and if you need to start over, do. So I'll close just to do a little self-promotion and then also to be more democratic about that. The SDG matrix, like I mentioned today, the one on healthcare and life sciences will be launched at the UN Global Compact. The others from financial services, the food, beverage, and consumer product sector, and one that we did on climate for COP21 are accessible on KPMG's Global Goals website. And I'll just flag another report that was done by the World Business Council for Sustainable Development, the Global Reporting Initiative, and UNGC as well. It's a fantastic report. In a way, we had some competition when they both came out of the gate last September. I think they work in simpatico. The compass will really walk each of you through, if you're looking at how to align with SDGs, how to do it, and our matrix will hopefully give you an idea. And Business for 2030 is a website I'm just going to encourage you to visit, given my time is limited, to engage and hopefully see some other inspirational ideas for how to engage as business. Thank you.